Good morning, and thank you for joining us here today. We're gathered on the traditional territory of the signatories of Treaty 6 and 7, and I acknowledge the Métis people who share a deep connection with this land. My name is Michelle Baer, and I'm the NDP candidate for Red Deer South. I'm joined here today by my fellow candidate for Red Deer North, Jaelene Tweedle. I want to recognize the significant undertaking by Alberta doctors and frontline healthcare workers across the province as they have dealt with not only the effects of the pandemic, but a lack of support from our current government. It is a considerable achievement to take care of others, especially under such adverse circumstances. A visit to a family doctor is usually our first experience with healthcare. We go for routine checkups, we bring our children or our parents. It's where we ask our health questions. It's where we manage our chronic conditions and form relationships with doctors and staff. But access to a family doctor isn't a reality for a growing number of Albertans. And here in Red Deer, that number continues to climb. Starting earlier this month, no family doctors listed on the Red Deer Primary Care Network's Find a Doctor website were accepting new patients. This comes following the retirement of some doctors here in the city, and we have more who are expected to retire over the next couple of years. It is deeply concerning that the UCP have not come forward with a plan to replace those doctors. I fear that the problem will get way worse, and that more and more people in Red Deer will not have access to the primary access point into healthcare. Without access to a family doctor, families are forced to seek medical care at the emergency room, or even leave their medical conditions until they reach a crisis point. And we have seen the effects of this at the Red Deer Regional Hospital, as capacity issues have lined up ambulances filled with patients 14 deep in our loading bays. And as people are airlifted out of the city because there is no room to treat them here in the hospital. People across central Alberta are arriving at our hospital with longer wait times than before, they're sicker than before, and the doctors and the nurses working in these emergency rooms can trace back the chaos they are experiencing to the collapse of primary care in Alberta. The Alberta NDP are committed to ending the UCP chaos in healthcare, and we will do that by rebuilding the foundation of primary care. We will do that with family health care teams. Through support and collaborative work, doctors and healthcare staff will be able to manage the load of caring for their fellow Albertans while recovering from the strain of the pandemic and the UCP government. And to tell us more about those family healthcare teams, I'd like to turn things over to Jaelene.
Thank you, Michelle. Primary care is meant to be just that, your very first stop in healthcare. The place you bring their family when they're not feeling well, the place you feel comfortable to ask questions and seek care. But for too many Albertans, that care is out of reach. It's an issue that is growing every day, and let me tell you, it is stressful. Like many in Red Deer and across the province, I recently received a letter from my own team within a day or two and close to their home. A family team can include multiple family doctors, nurse practitioners, registered and licensed practical nurses, social workers, dietitians, community paramedics, community health navigators, physiotherapists, midwives, speech language therapists, and others. With a range of primary care professionals, Albertans will receive help with questions, managing chronic conditions, and support to maintain good health. And healthcare workers will have the team they need to support them and operate an effective care setting to avoid burnout and manage patient load in a much more efficient way. There are similar working models of health teams in the province right now, in Taber and in Calgary. The Calgary Clinic serves more than 24,000 patients, and each doctor is able to handle 40% more patients than they typically would. And the system saves money too. The Calgary Clinic saved the healthcare system $57.3 million over 10 years, and the Taber Clinic saved more than $62.2 million. These clinics help Albertans manage their health outside of emergency waiting rooms, and we can build on their successes. With family health clinics, an Alberta NDP government will quickly establish 10 new family health clinics across the province, and Red Deer will be on the top of the list to receive one. We are also committed to engaging meaningful consultation with Indigenous communities and healthcare providers on how to best support Indigenous-led healthcare, and we will back that up with dedicated funding. We need stability back in healthcare in Red Deer. Families here are deeply concerned about the serious damage that Danielle Smith and the UCP have done to public health care. Even now, as the UCP announces another plan to make a plan to address the crisis in primary care, the dollars the UCP claim they will put back in primary care barely catches up with the cuts they have made over the last 3.5 years. The Alberta NDP will bring a stable, caring, and competent approach to strengthening our public health care, like we are presenting here today. With the family health team model, we can ensure 1 million more Albertans will be able to see a family doctor. We can save our system money in the long run and ensure our healthcare professionals are supported and enjoy working in Alberta again. Thank you, and we'll take your questions.
All right, thank you, Jaelene, and thank you, Michelle. We'll now go to questions, and we'll start with questions in person.
Hi, my name is Alessia, and I'm from RD News Now. So do you mind just reiterating the family health clinic? Are you saying that it's just the different types of doctors in one place? Like, what exactly is the model?
So the family health teams, just like you said, would encompass a whole team of people from varying backgrounds under one roof. So it wouldn't be going to your family doctor anymore, waiting for a referral to a dietitian or a physiotherapist or any other service you need. It's housing these professionals under one roof, which also alleviates the time doctors must spend on doing transfers and doing referrals. It gives them more time to see patients, and it gives the patients access to all the care they need under one roof.
Do you have a follow-up?
I know that the issue of finding a family doctor is a problem everywhere, that we are seeing all around the world even. So what makes Alberta in particular unique in this situation, or even Red Deer in this particular situation?
Well, Red Deer is one of the areas in the province, like Lethbridge and other communities within Bow Valley, that our needs we see. There are even more people without family doctors than we do see in other areas. So Red Deer is under unique pressures, and there's people like, I'm losing my own valuable family doctor, and I'm left wondering where I will go for my family now, with no doctors taking new patients.
Any further questions in person?
Susan Zelensky with the Red Deer Advocate. I'm wondering what the NDP would think about the UCP's, I guess, first, their focus on primary care networks.
The Alberta NDP approach builds on the model of primary care networks and takes what works in those primary care networks and expands on that. We know that we have a very robust primary care network office here in Red Deer, but we also know that there still need to be more family physicians that can be supported through a kind of a one-stop shopping model. So really that's what we have proposed in our plan, and primary care networks will be a strong partner with us as we move forward to develop the details.
Do you have a follow-up?
Would there be any other plan